So we're going to talk about macular degeneration now. We covered diabetes earlier. So what is macular degeneration? Who has not heard of macular degeneration? Who does not know what macular degeneration is? Okay, just a couple of people. So basically macular degeneration is nowadays a very common disease, a chronic disorder, which we don't really fully understand why it happens. But it is an age-related process. The full name of it is Age Related Macular Degeneration. And it features loss of central vision. And if you remember from earlier, we said the macula refers to the very center part of your retina. And so macular degeneration specifically refers to a loss of vision in the very center part of your retina. And just to put things in perspective, how common is this and how many people does this affect? Well, it is the most common cause of irreversible vision loss in Americans over the age of 60. So very common cause of vision loss in the aging population. Every year, about 1.2 million people lose part of their central vision. That's quite a staggering number of people that are affected by this. Of those, about 200,000 lose their central vision entirely to the point where they're legally blind. 15 million Americans are affected to some degree in general. If you think about how often a new diagnosis is made, every 3 minutes another person is diagnosed with macular degeneration. So while I've been talking, 2 people have been diagnosed with macular degeneration. And if we look at those who are over 50, 1 in 10 people has macular degeneration. Over the age of 75, 1 in 3 people has macular degeneration. So you can see just how common this disease is. Most of the folks that are affected, as we can see, are over 75. So it is, again, a very age-related process. Now, Charlie's condition is different. He has the juvenile form, and it's a much less common form, which obviously starts at a younger age. But what we're talking about here is specifically the one that's related to age. If we look at what's going to happen, the trends, they looked at the census data in the year 2000, and they said there were about 1.75 million cases of macular degeneration, which were the more advanced type. And the more advanced type, there's significant vision loss at that point. If we look to the year 2020, which actually at this point we're not too far away from, the projected number is close to 3 million projected cases, so 2.95 million cases. So a lot more folks are living to those years where their vision can be affected by macular degeneration, and we're just going to see the numbers continue to rise. So significant impact on society. What happens to your vision when you have macular degeneration? Well, the symptoms can vary. It can be very mild. You might just have some blurriness in the central vision. Usually things start out as waviness, so straight lines might start to take a little curve or bend to it. You might get some distortion of your central vision, and this can lead to further loss of central vision where objects may appear to be the wrong size or wrong shape. There may be a difference between the 2 eyes in the size of the images that you see. Ultimately, it may progress to the point where you have a dark spot or a blind spot in your central vision. When we talk about the features of macular degeneration, and if you recall, this is a picture of your retina with the optic nerve, the blood vessels, and the macula, or the center part of your retina. The hallmark of macular degeneration are these little deposits that develop, which we call drusen, and those are these yellow white spots that develop all throughout the center part of your retina. And again, drusen are the hallmark of macular degeneration. And we don't fully understand at this point why they develop or if there's any way to stop them from developing. When we talk about the different types of macular degeneration, and most of us who are familiar with the disease have heard this classification, there's typically 2 different types of macular degeneration. There's a dry form, and then there's a wet form. The majority of people who have macular degeneration have the dry form. So about 9 in 10 people have what we call the dry form. This is where we see those little spots, those drusen. You can start to see degeneration or loss of normal retinal tissue in the center part of your retina. It usually affects both eyes, and it usually progresses very slowly and can have a varied impact on the vision in the center part of your retina. Now when we talk about the wet type, and there's different names for that, they call it exudative or neovascular macular degeneration also. When we mention the wet type, that refers to the process where you start to get leakage from the blood vessels in the center part of your retina. And that can lead to swelling in the retina and bleeding in the retina. And that's why it's called the wet, because there's fluid in the retina. And here's an example of what that might look like with all this blood in the very center part of your retina. And this accounts for about 1 in 10 of those that have macular degeneration. And when you have vision loss from this type, it tends to be more rapid. So there's usually a very sudden change where things become more blurry, more distorted, lines start to look more wavy. So if you've been diagnosed with this, your doctor typically recommends monitoring your vision with a grid. It's called an Amsler grid at home. And that's to see if you notice that there's a sudden change that could indicate that you may have progression to the wet form, and that's why that's why we recommend monitoring your vision at home with those grids. So when we do the evaluation for macular degeneration in the office, you'll go through several different types of tests and examination. So it starts with a general examination of your eye and of your retina, where you sit at the microscope and we use bright lights to examine your eye. There are some other tests that might be done to see the extent of your disease and whether or not there's leakage or any wet activity. One of those is a fluorescein angiogram, where we take pictures of the retina. You get an injection in your vein in your arm of a colored dye that travels through your circulation, and then we take pictures as that travels through the retinal circulation. ICG, or indocyanine green, is another type of angiogram test that we do to look at certain types of macular degeneration. This may be done in addition to the fluorescein angiogram that we just discussed. OCT, I mentioned this earlier in the diabetic talk. This is like a CT scan of your retina, but it really uses only light, and it takes a matter of seconds to obtain this image. And that gives us a high detailed cross-section through your retina to show us all the different layers and tell us if there's any issues that we need to address. And this is a very safe technology. There's no radiation, and it's very commonly done nowadays, and it gives us a lot of useful information. And so that's a very useful modality that we use. It basically is like taking a live biopsy of your retina, and it shows us this is a normal retina, and it shows us all the different layers of the retina. And your doctor may show you these projected images. You can actually see the surface of the retina in 3 dimensions with these OCTs, and that gives us again a good idea of what's happening in your retina. And these are some examples of, this is an example of a dry macular degeneration. So the scan shows these bumpy areas down here where this line should be straight across. There's some bumpiness and jaggedness to that. And those are the drusen that I mentioned earlier, those deposits that develop, and we can actually see those on the OCT scan. Here's another example where you see this big bumpy area here. Another type of form of the dry, a more advanced form of the dry, you may hear your doctor mention this, is called geographic atrophy or atrophy. And this is where the retina just starts to thin away and break down. So you may hear that mentioned by your doctor. And we can see that on the OCT scan as an area where there's a disruption in one of the layers there. When we get to the wet point, we can see pockets of fluid underneath the retina. And those pockets of fluid tell us that there's leakage or bleeding underneath the retina, and that tells us that this is now turned into the wet type of macular degeneration, and that would require treatment. And these are some pictures that show us, again, a lot of blood. These spots are those drusen that we were talking about. The angiogram shows us different stages of that, and then the OCT scan shows us that pocket of fluid and that blood underneath the retina. So those are all different ways that we may evaluate the eye when you come in with the diagnosis of macular degeneration. There are a couple of other different variations of macular degeneration which are less common. There's something called polypoidal choroidal vasculopathy. This is more common in African Americans and in Asians. And there's typically a lot more bleeding associated with this type of macular degeneration. And you can see an example here where there's a lot of blood throughout the entire back part of the retina. Another variation is called RAP lesion, or retinal angiomatous proliferation. This is also very less common than the typical macular degeneration, but this may be another type of disease that your doctor may diagnose you with, and it tends to have a worse prognosis in terms of responding to treatment. So if they determine this is the case, it may help to know that this might lead to progressive vision loss and be harder to treat. Another variation that's closely related to macular degeneration but is a little bit different is called age-related choroidal atrophy. This is where the outer blood layer of the retina actually starts to thin away rather than the retina itself. But because the blood flow to the retina is compromised, then the retina itself doesn't function as well as it should. And that's another relative of macular degeneration. So let's move to treatment. How is this being treated nowadays? Well, there is some genetic testing that's being done, and I think we're not going to hear as much about it today as was originally scheduled. But there had been two tests available. One was the macular risk, and the other one was the retina gene, which is no longer available. And the idea with the genetic testing, and these were both indicated for folks who have been diagnosed with macular degeneration already, is to determine the percentage possibility of progressing to a more advanced stage. So what is your risk of developing the more advanced forms of macular degeneration based on certain genetic profiles? The utility for this in the future is sort of under debate and under question. We think that there is going to be some great utility for this. There's a lot of good research that's being done in this, and it also relates to vitamin therapy, which we'll hear about it in a later talk. So, what can we do for the dry type of macular degeneration? So most of the people who have macular degeneration have the dry type, and what is the treatment that we offer? Well, there's really not any good actual treatment. Your doctor will recommend that you take a certain vitamin supplement, and that the idea with the vitamin supplement is that it doesn't cure the disease, it doesn't treat the disease, but it's a risk reduction. So the idea is to help prevent progression to the more advanced stages, and the risk reduction is about 25%. So it's a significant impact in terms of how much it helps. But again, it's not going to reverse blindness, it's not going to cure the disease. It's basically just trying to prevent you from getting to a more advanced stage. So the way this was determined, there was a very large study studying thousands of people over many, many years. And that was originally published in 2001, and the original formula had high levels of vitamin C, vitamin E, beta-carotene, zinc, and copper. So that was the original formula that was recommended. Now from that, after that original formula was recommended, they found that in smokers, the beta-carotene actually caused potentially higher risk of lung cancer, and so they became a smoker's formula that eliminated the beta-carotene. Now, there were some other aspects of vitamin therapy that still needed to be looked at, and so they did a second study which addressed a few other things. There were certain pigments such as lutein and zeaxanthine that we hear about all the time that are related to the retina that are important for retinal health, and the question was, do supplementing those pigments in your vitamins make a difference if you have macular degeneration? So the second study addressed that, and also looking at omega-3 fatty acids, which we know have some antioxidant effects in the body, and so maybe that can help with macular degeneration also. And basically the recommendations were that the lutein and zeaxanthine, when they were added to the formula, had a similar benefit to the beta-carotene. So as a result, beta-carotene was completely eliminated from the formula, and now you don't need to worry about it for smokers so there doesn't need to be two different formulas. And they also found that there was no additional benefit from the omega-3 fatty acids in addition to the regular IRIDS formula. The original formula still has it, and if you take it, it's not necessarily harmful, but the study didn't find that there was any additional benefit. So when are you supposed to start taking vitamins? Well, the recommendation based on the study, and this is just based on the medical recommendation, is that if you have intermediate macular degeneration in at least one eye, or advanced AMD in one eye. And so that's basically the true medical recommendation. Now people ask me all the time, well, I just have the very beginning stages, it's still early stages, should I take the vitamins? Well, I say, you know, it's probably not going to harm you, and if you have some early signs, you might want to take it. If I were in your shoes, I probably would take it myself also, because then you're doing whatever you can to prevent possible progression. But from a medical standpoint, the recommendation is that you have to have intermediate or advanced. So let's switch gears to treatment for the wet type of macular degeneration. And we were talking about this earlier. Prior to the advent of the medications that we give as injections, as you heard about earlier, there wasn't a whole lot we could do. When someone developed wet macular degeneration, we knew that they were going to lose vision. And our goal was to say, we want to try to stop you from losing vision as best we can. However, you're going to continue to lose vision. Let's just try to slow it down doing whatever we can. So there were several treatments that were used. One was laser treatment, and the idea was the laser was just going to zap away and burn those abnormal blood vessels that are growing in the eye and try to stop the leakage and the bleeding. However, if you can imagine, if you're using a laser to destroy those blood vessels, normal tissues are going to be destroyed by the laser also. And so you created extra damage in an attempt to reduce progressive vision loss. So this was really the only treatment that was available for many years, and not a very good treatment because of the side effects. Another type of laser which we still use nowadays, not quite as much, but it's still around, and so your doctor might recommend this also, is what is sometimes referred to as a cold laser, or photodynamic therapy, PDT. We call this a cold laser because there's no actual heat or damage to the eye structures from this type of laser. And this is used in other body parts, such as on the skin for melanoma, as you can see here. But basically what happens with this type of treatment, it's a two-step process. First, you get an infusion into your venous system, so you have an IV that's started, and there's a dye that's infused into your system, and it's allowed to circulate for about 15 minutes through your system. And then we know it gets into the retinal circulation, and then we use a different type of laser that's actually directed into the retina to activate that dye as it's running through the retinal circulation. And somehow that chemical process stops those blood vessels from leaking. So that's what we call the cold laser. Now the mainstay or the gold standard for treatment nowadays is these injections of medications. And this is, again, given directly into the eye, done in the office. Typically for most people, when you turn into the wet type of macular degeneration, the injections are given once a month in the beginning. And then depending on response and how well the treatment goes, that may be extended to a longer period of time, so every other month, every 3 months. Some people don't need ongoing treatment, some people do. There are folks who have received over 100 injections in their eye and they still need ongoing treatment. So the course or how often you need treatment is variable. I typically tell people that there's a possibility you may need this for the rest of your life. In some cases, like I said, after some time you may not need treatment, but you have to be prepared that it's a possibility that you could need this indefinitely. So the medications that we have available, and I had talked about this a little bit with the diabetic macular edema, there's three FDA-approved medications. The first one was called Macugen, and this one didn't last very long because soon after Lucentis came out, and Lucentis was much more effective. So Macugen had maybe a year or so where it was used, and then Lucentis came out and sort of replaced it. Lucentis was approved in 2006. That was the first medication approved, the second medication approved for the wet type of macular degeneration. And that sort of revolutionized how we have been able to treat wet macular degeneration. Now we have good prognosis for folks if they get in early enough that we can start the treatment at an early stage. Since then, a third medication has been approved called Eylea, and that one is produced by the company Regeneron, which we heard about earlier. And this is also an effective treatment for wet macular degeneration. So your doctor may talk to you about all the different options. Finally, there's another medication which we use very, very commonly. It's called Avastin. And this is also given as the same type of injection into the eye. The difference is that this is not technically approved by the FDA for use in the eye, even though we use it all the time, and it's safe and effective, and it's covered by most insurances in general. It's not technically approved by the FDA, and the reason for that is that it's actually a cancer medication. And the cancer medication comes in these huge doses, and then the pharmacy will take them into the very small doses that we use for the eye, and then deliver it to us in that form. So not technically packaged or meant for delivery to the eye, however, we safely and effectively use it for the eye all the time. So there have been many studies that have shown us the effectiveness of these medications in treating macular degeneration, the wet type of macular degeneration, and this was from one of the original studies that showed that there was leakage on the OCT, if you remember the optical scan that we talked about earlier, and after treatment there had been reduction in the swelling or fluid in the retina. And just to show in graphical form, this basically shows the amount of vision that is either gained or lost with treatment. In this white line, this was the sort of placebo or no treatment group, and you can see over time they lost vision. And this group here are the different treatment arms, and they were getting injections regularly, and you can see that they actually gained vision after treatment. So before, if you remember, I said at best we could say, well, you're going to lose vision and we're going to try to slow it down. Now we can say we can actually maybe improve your vision once you've gotten to the wet type of macular degeneration. So things have changed dramatically in the last 10 to 12 years. When we compare the different medications in general, we think they're all fairly equivalent. There have been some studies that have compared the two, and in general we think all the different medications have a similar effectiveness. So, that's a discussion to have with your doctor if they recommend one versus the other. You can probably be safe to say that they're all very equivalent. At some point they may say if one is not working well enough, sometimes you switch to another one. That's not uncommon. So I'm going to talk a little bit about another technology that's used for, that we have approved for treatment for macular degeneration. This is called the implantable miniature telescope, or IMT. And this is a tiny little device that is, as you can see, very small here, which is implanted into the front part of the eye. And if you're familiar with cataract surgery, during standard cataract surgery, a cataract is removed and there's a lens implant placed in its place. And that's a synthetic lens implant that's put in the front part of the eye. With this implantable miniature telescope, rather than a standard lens implant, this tiny little telescope is placed in the front part of the eye instead of a standard lens implant. And how does this help with vision for those who have lost vision from macular degeneration? Well, what happens is, let me skip ahead here. Basically, this telescope takes the image that you're looking at and magnifies it so that it's projected onto a large part of your retina. So say your very central vision is affected by macular degeneration and you can't see anything right in the middle. Well, that image is projected onto a very large part of the retina so that that larger image, you try to use more of your retina to see rather than just the small part. It sounds great and it sounds real simple and easy, but it's not quite as easy as it sounds. I'll just review some of the features that are required for this. So you have to, it is FDA approved. It has to be done at the time of cataract surgery. You have to have very advanced or end-stage macular degeneration. You can't have any active wet type of macular degeneration. And your vision, you have to be in the range of where you're basically almost, in your central vision, almost legally blind. And there is an age requirement. You have to be over 65 to receive this type of treatment. So again, the central vision that's lost by magnifying the image and projecting on it, you have to train your eye and your brain to work in a different way. So there's a lot of training that's involved if one is recommended this particular implant to try to adapt to a different way of seeing. It's basically relearning how to use your vision so that one eye uses the projected image to try to get more facial details, being able to read a little bit, and the other eye is still used for peripheral vision and navigation. So that takes a lot of practice. You have to work with an occupational therapist and a low vision specialist for weeks to try to adapt to the new vision. So that's one other exciting thing that's potentially available as far as surgical treatment for macular degeneration. And you may be hearing more about that in the future. Other future treatments, again, very similar to the diabetic diseases, a large part of the focus is on newer medications and newer way of delivering medications. And there's a lot of active research, a lot of active trials ongoing looking at newer medications that are potentially more effective or last longer than the ones we currently have. Some of those are in the form of eye drops, some of them are in the form of oral medications that you take by mouth, and then others are given the same way that we currently give the medication, which is by an injection into the eye. So for the dry type, as I said, there's no real effective treatment at this time other than prevention with the vitamins. There are some things that are being looked at to try to slow the progression of the dry type. One of the more exciting ones that is undergoing trials right now is called lampalizumab. My group was involved in is involved in the original trials looking at the effectiveness of this. This is given as an injection into the eye also, just like we currently do. And the idea is to slow the progression of degeneration or atrophy in the dry type of macular degeneration. So we'll see if that one gets approved. That may be an upcoming treatment. There's a stem cell therapy which is being looked at, and there's a trial that's being started very shortly here that is actually looking at a stem cell surgery where stem cells are placed underneath the retina and for the dry type of macular degeneration, in hopes to try to regenerate some of the retinal cells. Now you have to be careful because there are some trials out there that people are advertising, and this was just here in Florida, some cases where there were bad outcomes from stem cell treatment that was done by folks that were not medical doctors. So you have to be very careful if you hear about a trial and making sure that you are going to a trusted source. And unfortunately, the folks that were treated here in Florida by that particular institution, there were some severe vision loss as a result of treatment for folks who had good vision to begin with. So, for the wet type of macular degeneration, again, we're looking at newer medications for treatment and newer delivery medications. One of the other exciting avenues that we're studying, and my group has done about 6 of these surgeries. We're one of 20 places in the country that are participating in this clinical trial, is a surgically implanted device, and it basically acts as a reservoir that delivers the same medication that we're using currently over an extended period of time. So rather than having to get injections every month, you get one surgery, minor surgery, that has a little implant that slowly releases medication over time. And we have people who after 6 months, 9 months have not needed additional treatment, as that medication has been slowly released over time and keeps the disease under control. So that's another exciting treatment that we hope is going to be approved in the near future. Other treatments, they're looking at combination treatment, so there are other molecules that can be used in conjunction with the current medications that we do. So sometimes two medications are better than one, and using two different things can have a better effect and maybe a longer lasting effect than just one medication. So a lot of exciting research is being done, a lot of new medications are being looked at, and so we hope to have newer and different ways of treating the disease in the near future here. There are some other surgical things being looked at also, such as radiation treatment, where radiation is delivered directly to the retina from inside of the eye. Transplanting parts of the retina, this is a more experimental type of procedure, done more so in Europe, not really being done here, where healthy parts of the retina are transplanted into the macula, or the center part of the retina. And in the future we may see other forms of artificial vision, such as retinal implants, things like that, but those are many years away. There is a retinal implant which is actually approved for a different condition, which is retinitis pigmentosa. That's a genetic disease, but that may down the road have some crossover and applicability to macular degeneration. So there's a lot of exciting things to look for. And I'll conclude with that.